So, Amber, we are live here. So, what a great presentation you just gave. I really appreciated all the information that you shared.
Yeah, thank you so much. I mean, I think based on the presentation, I think we can all understand that things are moving fast and furiously ahead. And most importantly, I hope people feel after this presentation as though it's overwhelming for all of us, myself included, who covers the technology space on a regular basis. And I understand it's hard to keep up. And I just hope that people who often are searching for that perfection understand. I think that we live and understand that this is an imperfect world, and sometimes, just enough is enough.
Exactly. Yeah. It's what's something you mentioned in the chat comments, right? Is that perfection is the enemy of good? Or did I say that the right way? Is that the right phrase? Yeah, absolutely. And I think that that's one important lesson as we look at how technology is unfolding, particularly in our industry. Our industry is healthcare is notoriously very cautious about new technologies, new adaptations, because there's a lot of concern around, we might make the wrong misstep. And oftentimes in healthcare, the wrong misstep can result in, impact and harm to humans. What are your thoughts on that?
It's really interesting you say that. So the past few years, I have co-hosted a podcast called The AI Effect. And I will never forget one particular episode where we interviewed the chief AI scientist at Sick Kids Hospital in Toronto. And what she said to us is she said that one of her fears was that people became so paranoid about their personal data and privacy that they would no longer share, even if that data was anonymized. And she worried that this would be to the detriment of healthcare because they would not be able to properly have enough data understanding, why kids come into emergency, what they come in for, some of the possible symptoms, if there's anything more severe possibly on the go. And she said that we do live in a state as well. We have to be careful about privacy hysteria. So I'm not saying that privacy and data is not important, but I do think that we have to understand how technology works. A great example is the COVID app that we have in Canada, and the government has released this app that's available across the country. And it's a very, very well-designed app from a privacy standpoint that does not share location. All of the information is shared via Bluetooth, and yet there are people who still come out and do not understand exactly how the tech works. So let's make sure if we're paranoid about privacy, we understand the technology that's in place.
Yeah, that's a really good point. And as you're describing this app right here in south of the border for you, right here in the United States, we're all different entities or states or whatever are trying to go down this path. And I think the pandemic has really shifted the way some people are looking at technology and how to use technology. And I think that some of the points that you outlined in this presentation really speak to a future in a post-COVID world. Is that fair?
Yeah, absolutely. And I think one of the things that I really tried to hit on, and I saw many people in the comments in real time chatting about this, and I would just love to know what people continue to think about this theme, is the acceleration of this technology. Because even for myself as someone who's been speaking about AI for the past few years, I didn't anticipate that it would accelerate this quickly. But the difference is that it's not accelerating evenly for everybody. In fact, there are the companies and the organizations and the individuals who are embracing it and moving forward. There's the regional effect as well. If you look into parts of China, they're already using robots, like I showed in the presentation, within hospitals to do things such as take temperature, monitor for proper wearing of masks. And so I think what we'll see is this unequal distribution of this acceleration of technology. And that's a little frightening because we see this gap widening.
Mm-hmm. Yeah, absolutely. And I think I refer to it, and it's a common term, right, about digital health access or digital health equity, right? And when you think about these technology tools that are coming into play are very good, but there is a bit of issues that we have in terms of normalizing that across multiple different audiences. Is that fair?
Yeah, that's totally fair. I mean, and if I can get a little bit sci-fi nerdy with you, Chris, there's a quote that people may know from William Gibson: "The future is already here. It's just not evenly distributed." And I think that we are all feeling that right now with this new technology and this larger divide. If we don't understand how to adapt and adopt some of this tech, you recognize it feels like you're going to be left behind more quickly than ever before.
That's great. I see that Chris Hempel actually posted that quote right in our chat window right before you said that. So great minds think alike there.
Great
So
nerds.
exactly, we're all many of us are those great nerds. That's what's so exciting about this. Amber, I wanted to go back and kind of touch on some of the things that you introduced, because these four different trends that we're seeing in the new technology. One of the first things that really sprung to mind, we were talking about how quickly technology is being adopted by all of us, and I kind of got this sense in my mind. In the back of my head, I scratched down, are we as digital consumers now following Moore's law, in that suddenly we're now going to be rapidly adopting to these new technologies?
Yeah, I mean, I think we saw that with the slide on smart speakers in terms of adoption within the United States. And if you think about smart speakers, I think this is a really good example, because just a few years ago, smart speakers did not exist. And now, more than 50% of homes you probably go into on a daily basis, they have some sort of smart speaker in their house, or they're just starting to experiment with them. And again, we've seen that acceleration during this time. So to me, it does feel like there's a term in the tech world that we use, which is called hyper adoption. So if you think about things such as the personal computer, and someone put in the chat that it's the 40th anniversary of the personal computer, that's 4 decades. It took a long time for computers to become common in our offices, in our homes. But all of a sudden, we're seeing new technologies like smart speakers, wearables, that it feels as though we're having that hyper adoption, which means it's no longer 4 decades or 1 decade. It's a couple of years before it becomes commonplace.
Yeah, absolutely, absolutely. And the applications of all of these voice-first technologies, which I think are so fascinating, we're even seeing health systems start to adopt them. I know that there are some health systems on the East Coast of the United States that are actually putting them into their operating rooms and allowing for voice-enabled capabilities, in OR suites. And I actually made a prediction about a year ago that says a lot of the large electronic medical record companies like Epic, et cetera, that are in the United States, that it would be a logical step for them to adopt these tools, because it's just so easy, particularly within a healthcare setting.
Yeah, it's also the accessibility standpoint. I have a lot of people, especially on Twitter, who will come to me and who are frustrated about the pace of technological change. And I sometimes like to remind them that this just isn't something that is happening for able-bodied people, but there are many people from an accessibility standpoint. Senior citizens is one example. Voice becomes a very powerful tool. And I want to just share a little story here. If you think back to the early days of Apple, when they came out with the iTunes Music Store, and you remember your first experience signing up for an iTunes account, figuring out how to download the music. You had to pay 99 cents per song, getting it onto your iPod or wherever you're going to listen to it. How that's kind of a clunky, cumbersome process. Think to today, and I think about my parents who are in their mid-70s. They love music, but they haven't listened to music regularly for 10 plus years because it's become too difficult. Now with a smart speaker in their home, they're playing all their old favorite Beatles songs and Elvis songs as well. So from an accessibility standpoint, there are many, many reasons why this technology makes sense.
Yeah, absolutely. Now we have some questions that are popping up in the chat, and I want to share one of them. It looks like Lisa Smith asked, who's going to ultimately decide the results of where these technologies play, like smart speakers? I think that's a big question, right? Who's going to be overseeing this? Who's going to be making sure that we're applying these in the right ways?
Yeah, it's a great question. I mean, and I think that's why it's so important in terms of digital literacy, which is a term we've been talking about, but I don't know if everybody practices it. But understanding that learning about new technology is important, and learning about the companies, the big 4 tech companies that are essentially running our lives in one way or another, understanding how they operate. Because right now, if you look at some of these companies, I mean, some of them are on the right path, some of them are not on the right path. If you look at Facebook, I mean, so many issues there. If you look at Google and data, and privacy, so many questions we can ask there as well. So to me, it feels like the big tech companies are in charge right now, and unless consumers actually are active participants in understanding and asking questions, I think we are at risk of potentially letting these companies run our lives. And I use all this tech, so I'm fans of these companies, but at the same time, I'm also skeptical.
Right. Well, the educated user, right? I think that's an important piece. And oftentimes when we're looking at in a healthcare setting, some of the people that we're treating, they're not literate with technology. And we see that with telehealth and other situations when we're trying to engage older people that are not maybe familiar with Zoom calls. But, inevitably, it's about usability and adaptability, right?
It is. And, you know, that's been one of the things that has happened over the past few months to me as someone in the technology space is I'm getting emails all the time from people who are struggling because right now they have to work and know how to operate a computer, know how to get onto Zoom, know how to use all of this technology. So it feels like, again, if we use that term acceleration, I think we've all felt that during COVID-19 because we've been forced to be our own IT managers. We've been forced to understanding, how to leverage this technology because without it, we're isolated in our homes, and there's never been a time where we have been forced to learn about how technology works and become more literate like there is now.
Right. So now let me pivot a little bit and talk about these different technology companies. You have been in this space for a very long time, and you understand sort of the success factors. We had a question that pops up that says, that was asking about, there's a huge entrance of people coming into the space wanting to create all these different types of solutions. What do you see? What's your perspective on which companies are going to succeed and which ones aren't? What are some of those factors that that make companies successful?
Well, I do think, I started my career in San Francisco. I think that was in my introduction in the late 1990s. I know I'm dating myself here, but nonetheless, I remember those days. And in those days, I think we looked at Silicon Valley as kind of the center of everything. That's where all of the technological innovation was going to happen. I think the good news in terms of what's happening today is that we're seeing these smaller pockets where technology sectors are popping up. There are really interesting and innovative startups that are doing amazing things that are small, that are nimble as well. So I think we have a little bit of that momentum. At the same time, there is, of course, that risk that we are moving too fast. So as much as I love this acceleration that we're in right now, I've seen a number of examples, even when it comes to things such as COVID-19 vaccines, that have been pulled out of market quickly in terms of some of the research that's been shared and done and testing. They're just moving too quickly. So I think there is that risk, and it's almost like finding that sweet spot of moving forward, but being careful and cautious about decisions that you're making. So just to get back to your question, I think when it comes to technological innovation, I think we're going to see a lot more startups who have a place in this game, but they're going to have to be very careful. And I think also at the core of that is a conversation we've been having for years now, but more importantly in 2020, is the diversity angle. If you think about teams building technology, especially building software and designing software, you want to make sure that you have diverse teams. And that's something that does not happen overnight.
Yeah, that's absolutely true. Not only diversity in terms of your solutions, but diversity in the people that are actually helping you with your designing of your solutions. And I think that's an important piece. And I find myself that, the most successful companies in the health tech space are those that actually partner with those that are delivering care on the front line, but also bring in that outside sensibility, because I think that makes the perfect combination.
It does, or else you end up getting this technology that's designed that only makes sense for one type of person. I did an event recently, a really large event. They do events all over the world, and they into their platform, their live streaming platform, they built within the feedback loop the ability to throw tomatoes at speakers. Now, I do not have to investigate who was part of the development team who made that up. But I'm going to say there weren't a lot of women on it because that is so rude and crass. So there's a great example. I mean, it's 2020, and that was part of this large company's platform.
Very interesting. Well, I want to pivot to one of the second trends that you pointed out was about these autonomous machines, mobility machines, et cetera, and even robotics, right? I see a lot of great applications in healthcare, and it's interesting that you brought up the example of the University of Michigan, because we have some people from the University of Michigan that have been attending this conference, and they may even be in the chat window here. But I see a lot of other applications too, because one of the biggest challenges we often face is allowing to either providing pharmaceuticals to our patients, and or bringing them into a clinical setting. And there's a lot of interest in that. Do you see a role of these autonomous machines maybe being applied in this capacity?
I think there is. And, sometimes we think about robots, and unfortunately we see that image that I showed where Elon Musk was in the headline of these scary Terminator-like robots that are going to come and kill us all. But we have to start to think about robots more like machines. And those may be, they may be robots that look like little robots, or you could consider machines things such as smart speakers that have a number of different functions. So, as one really simple example of this, in South Korea, they're using smart speakers right now and for seniors in homes, and when they detect that there's not a lot of sound in the home or a person interacting with the speaker, that's a red flag that someone should come and check on them. So I do think we're going to have to get more comfortable, especially if we want an elderly population to continue to age in place. Yeah. I think we're going to have to see more and more machines and robots as part of that. So it will become normal when it becomes less expensive, and that's true of all technology.
And I've attended some of these robotic conferences, and there's a big focus on making the robotics a little bit more empathetic, right? And even in the visual design and look of them, and you saw in some of your examples, the robots look, I guess, less threatening, right? They don't look like the robots of the science fiction lore. I think there's a big role here of design into the application of these systems as well. There
is, and to use another example out of China, they're using robots right now at plenty of schools where the kids, when they walk into school, they meet the cute little robot. Some of them look like R2-D2, and the robot takes their temperature, makes sure they have a mask on. And I think about my son. He's 11 years old, and fingers crossed he will be going back to school in a safe way in a couple of weeks. If they had something like that at their school, this would change the relationship, I think, with the crisis that we're in right now, because the robot they would name the robot, they'd probably dress them up. You can only imagine what would happen. And again, I know it's not affordable for everybody yet, but it will get to that point that it makes sense to have some of these machines or robots throughout our lives.
Right, exactly. Who would have thought that George Lucas would have such an impact on how we're developing technology for the future? But I agree with you 100%. We want to. That's a big part of this, is because when you're in a healthcare setting, there's a lot of sensitivity. And I know that there's been a lot of questions, and there's one even in the chat here about the creepiness factor of using technology in a healthcare setting. I think healthcare is so intimate to people. What are your thoughts on that?
Okay, so I have my smartphone right beside me. So I will say that this is the creepiest piece of technology that you have in your life. So if I go to events and talk about smart speakers, inevitably someone raises their hand and said, how could you even condone these smart speakers in people's homes that are always listening? And I said, you know what, you are right. There are privacy concerns with all technology. But if you are really worried, you should throw your smartphone out the window and never use it again. Because what's that doing? You have a cellular signal that is essentially able to track where you're going. You're buying things on your phone. It's always with you. It's always in your pocket. It has things like Google Assistant or Siri voice assistants built into it for listening. So I guess my point is let's understand the technology first before we become nervous about what technology we're using. So am I afraid if a robot was in my home that there would be issues? Probably no more so than I would be of using a smartphone, which is the gateway drug to all privacy invasions.
Right, absolutely. It's interesting too that you talk about your smartphone, which I consider one of the biggest Internet of Things, right? Is like when you talk about IoT, this is like the biggest device that you carry around with you. But I do want to pivot now to the third trend that you were talking about, which are wearables, and particularly wearables in the application of wellness and health. We've been talking a lot in healthcare, and the pandemic again elevated this discussion around things like remote patient monitoring and having devices that are now integrated into our lives. So talk a little bit about that. You shared some great ones, right? Ayana, Whoop. Share us a little bit about other perspectives around this.
Well, I think it's exciting that the wearables market is becoming so sophisticated so quickly. And again, I would argue this is in part due to the world that we live in today, especially when it comes to health. And if you look at the NBA as one example and know that their players are wearing the Oura rings that can take their temperature and measure other things such as their respiratory rate, that's a fascinating piece of technology. I mentioned the Whoop bracelet or the Whoop band that I have. I know there's a couple people in chat who have it as well. And And one of the things I love about this is just all the data that you have at your fingertips. So I can find out if I've reached my maximum strain. That's from a fitness perspective in terms of exercise. It measures my sleep and also measures something called recovery. Now, this is the piece that I probably have forgotten about over the years when I was traveling and running off my feet, is that sleep and recovery are just as important as the other things. So it also measures respiratory rate. I have all the data. But really, Chris, at the end of the day, the reason that I'm using this and wearing this is because I don't have to take it off to charge it. So it goes about a week on one charge, and you put this little charger on top of it for an hour or two to charge it up. Whereas my smartwatch, which does some of the same stuff, I have to take it off every night. So I know that my health data isn't really accurate because at nighttime I'm taking it off. So my resting heart rate is, not what it actually is. So to me, it's a sophistication that we've seen in the past year or so that is only going to continue. So that's exciting to me because all of a sudden there was an article that went out a little while ago that says data is the new selfie, right? And to me, it feels like that. Like I'm sharing more data on social media than I ever have, just because it's interesting when you start to understand your health in that form. And I guess my question back to all of you and the people watching is, what does that do with a connected and engaged consumer who knows all of these things?
Right. Well, what's interesting too, I was just reading a recent Deloitte study that was talking that they reached out to healthcare patients right now. And what they found is that there are two types of people that are really embracing this concept of data being the new selfie, where they're tracking themselves so much more effectively. And those are people that are very obsessed about staying healthy and well. And there's a fair number of us that are in that space. And the other are people that have chronic conditions in which they have to, where they have to manage all of that. I happen to, by the way, be in both camps because I'm a type 1 diabetic as well as, an active, healthy, at least I try to be, 52-year-old, right? So here I am trying to bridge both gaps. But, I think that this whole concept of data being the new selfie is interesting because that really it empowers the individual patient, the individual person as being in charge of their health data, right?
Absolutely. And what's the goal? Like, obviously, I'm not a healthcare professional, but what's the goal? I mean, the goal is, going back to that story I told about the chief AI scientist at Sick Kids, the goal is to save more lives, is to help people be healthier. And what's going to get us there, right? And I think you're right. If people feel empowered and understand their health a little bit more, it would be my expectation that helps them in the long run. And, we're not talking about, this isn't a Dr. Google search, right? In the early days of the web, everyone was like, oh, okay, stop diagnosing yourself. I'm not diagnosing myself with this. I just know on average what my resting heart rate is. I know my respiratory rate. I know my sleep. All of those things could be important pieces of information for my doctor because I've kept track of them.
Yeah, absolutely. The big disconnect though between like Internet of Things and like the traditional healthcare setting is that traditional healthcare settings are kind of siloed. They have their data in these electronic health records. Health systems can carry a lot of data around patients, and the patients themselves are now starting to collect. And I know there's this whole conversation about interoperability, and we're not set up as in a society really to start sharing data. And this kind of leads to the fourth trend that you were talking about automation and data, machine learning, and those sorts of things. So I'm curious about your perspective on this. Tell me.
Well, I think you're right. I mean, we see this in the technology space as well. And the only company that is a little bit open about data sharing is Google. If you look at all of the big tech companies, I think of Apple as one example. I mean, they're a little more of a walled garden system as far as how they protect their data. But we see more and more Google, I think, playing nice and playing friendly. And I think that's what's going to become necessary. So, whether you have an Android phone or an iOS device, there's information that's being shared. But how do we get it to these devices that are not owned by those tech companies? And it's starting to happen. So I think that playing nice together, to be honest with you, I think the interoperability is going to have to be a reality for any of this to make sense. Yeah. And I hope that does happen with a new generation of technology designers and developers who, again, are going to play nice with each other. Because if you look at, not to get too into the tech space, but if you look at the tech leaders we have today, Mark Zuckerberg started Facebook as hot or not on the Harvard campus, right? So we need to kind of move on from that. Absolutely.
Well, Facebook has so many connotations, negative that are associated with them. However, they have done some incredible things too, right? To understand how technology can influence behavior and influence, your own emotions. And I think that there are some interesting experiments that are being done. But Google, there's a lot of I agree with you. It's one of the most open that are out there, but it's also the one that could certainly be challenging because I think many people still associate Google as being an advertising platform.
Yeah, and what happens when, they can't do that anymore? I mean, how do they exist in the same capacity that they exist today? And we've seen so many examples with Google as a large organization that has tried to do things such as smart cities. Here in Toronto, they tried to build a smart city. The city was up in arms. There was a big fight that went on for a couple of years. And then they just, they pulled the project, which is unfortunate because I think smart cities are the future as more and more people live in urban areas. It makes sense to figure out how to make them smart. Yet we live in a world where, people just can't seem to agree on anything.
Well, that maybe is a positive, right? I do like that sort of that rugged individualism that many of us have. But coming together to solve complex problems, our world is facing that right now. And so I'm curious about your perspective on that. I think that there are some interesting things. You mentioned the app that is being used for contact tracing efforts. Have you seen other types of interesting advancements that might looking at this global pandemic that could also have an application in healthcare?
Yeah, I mean, I think it's a great question. And I think that really what it comes down to, especially if you see some of the tracing apps that have launched around the world, is that they only really work when there is one thing, which is trust in the government that's rolling them out. And we've seen that in places like South Korea. In Canada, most people trust the government, even though there's a few people who don't. Generally speaking, people believe that this is a good thing. The same thing with mask wearing, right? So, that's one piece of it is that trust. And has that trust been broken? And then you have a total collapse or deterioration, which is, of course, an issue. So from my perspective, I think the thing that is the most interesting in the space right now that's relevant to healthcare is the countries and places that are accelerating with new technologies that are AI-based, so artificial intelligence based, in places where they're able to accelerate without, getting pulled back by a society that's just not ready for them. So I think that's why, China will end up doing laps around us in many ways because I'm not saying they don't have their own issues, but we can see that acceleration is able to live there and the innovation side of things is able to exist.
I think that you subtly have described some of the challenges that we're facing here in the United States, right? Is that we approach healthcare in a very pocketed sort of way, and I agree with you that there are a lot of countries that focus this on a much larger national level, but also an international level, right? Because this is a global pandemic. This is impacting all of us. We can't shut down our borders. That's just not the solution. Right?
Yeah, no, I think you're right. I mean, listen, if anything, I hope that we have learned over the past few months what we actually need as a society, whether it's in leadership or in technology or in the public, from that trust standpoint. So I think that it's been months and months of lessons that I hope people walk away and say, hey, you know what, we gotta do better next time. We can't live like this, right? We can't just be shutting everything down and holding people up inside their houses. There's got to be a way to leverage some of this new technology to make this process a little bit easier. And even some of, in Canada as one example, it took them a long time to roll out this contact tracing app, right? And that we need in some cases to act more swiftly. So I hope it's been a months of learning. That's the most positive way I can say it.
Yeah, no, I think that's a fair point, exactly. But, many of the people that are attending this conference, their role are communicators, professional communicators within health systems. And I think that this is a unique pivot point for our professions to be able to, one of the trends, one of the themes I'm hearing from you, Amber, is that a lot of this technology is misunderstood and we need to adopt these technologies. So do you have any words or thoughts around professional communicators in healthcare, how they can start to help to maybe, demystify these technologies?
Mm-hmm. Yeah, if you look at the artificial intelligence space, one of the most popular roles in demand right now is not the AI developer or not the founder of a company. It's the explainer. It's that person who understands how to explain technology and demystify it. You use the perfect word, and I think as far as from a communication standpoint, it's understanding that you need to talk to people in a way and understand they only understand understand things at a very basic level? And how can we communicate better in a way that we're able to describe things, explain things with full transparency? And that may mean, maybe you have a terms of service or a privacy policy or some app you're planning to roll out. Make it as simple as possible, right? And I think that's the thing that we've forgotten is that, communication at its core needs to be simple to be effective. And I think right now people want that transparency. They don't want to be confused. There's too much confusion in the world. And how can we clearly speak to people in a way that is demystifying the things that they need to understand in their lives?
Much like all of these technology trends that you outlined, which are becoming seamless and, in our lifetimes. I mean, many of us, maybe we don't know we've talked to chatbots, but we probably have, like through online interactions. All of these things are becoming seamless, and that's the kind of the noble pursuit of technology, is to make it just a seamless part of our lives. I think to carrying your point forward for communicators is to help make this a seamless transition as well, because we are certainly now, the pandemic has done a lot of things to us, but it has elevated us as digital health consumers.
Yeah, and I think, again, people then go, well, I am communicating clearly. I am communicating in an effective way. But I'm going to be honest with you. Like, sometimes I'll test things on my 11-year-old. Like, do you understand this? Is this clear? And is this effective? And I wish I had a screenshot of it right now with the COVID alert app that we have in Canada, because as soon as you log in, it says 4 things. There's no long privacy policy. It says, we do not collect your location. We do not do this. We do not do that. We do not do that. There's about 5 things that it says in simple little sentences in bold, and that's it. Like, that's their privacy policy. It's so clear, because I think they know that if it isn't, then people, they're just not going to trust or use this technology. So if we can go back to the basics, I think that's really effective from a communication standpoint.
That's powerful words, and I know a lot of us that are listening in are totally agree with you on that. And I think that's one of our biggest challenges, right? We have to simplify the complexity.
Yeah. I mean, it happens to me. So I've been speaking about artificial intelligence for 3 or 4 years on the speaking circuit, doing the podcast, and I've never been busier. And I don't think it's because, I'm, incredible across the board, but I have watched speakers who talk about artificial intelligence way over people's heads, who just confuse them. So again, I think there's something special about being able to communicate in a way that is accessible to people. And you're not talking over heads, you're having conversations, and that transparency exists as well.
Well, you outlined some really great examples and trends that are impacting our industry for sure. The keynote was amazing. And just for people listening in, that keynote will be available. The slides will be available. Yeah. The forum will provide those to you all after the session. So you'll be able to download those. But and I also would highly recommend for people to follow up with Amber. Amber, you do some really great communication. You share great information. Are there any last parting words that you want to give to the audience today?
Yeah, I mean, I'm standing here today saying all of these different things, but I could probably come back and do another keynote next week because I've learned something new. And so I think if there's any parting words, what I would like to say is just pick up on that quote that I shared from Alvin Toffler, where he talked about how to essentially succeed in the future. It's the people who are able to learn and unlearn. So I would just put that out there, and I think we are so determined sometimes to always be right, that now is the time, I think, for understanding and approach that just being flexible, right? And I think that's how we are all going to be able to move forward together, is accepting we don't know everything, but we're going to try to learn, but maybe next week we learn something new. And it's okay to live in that kind of imperfect world. That's life, especially right now.
Yeah, absolutely. Well, Amber, thank you so much for all your time today. And this Q&A session was really great. I know a lot of people found value from it. So just really appreciate just catching up with you. It's great.
Yeah, thank you so much. And you're right, I'll make the slides available and send them over to the team, and they can share them if there's any links. And I'm easy to find online if anyone has anything else to share, not just to ask questions, but even if you have things you think I should add to this presentation or other presentations. I am also learning on a daily basis, so I would love to hear.
Yeah, absolutely. Well, thank you, everyone. And I hope you enjoy the rest of the day of your conference.